Hello po uli. Parang nakamute ata ako. Hello po and a beautiful morning. It's Tuesday before the lockdown and thank you for joining us. My name is Dr. Anna York Bondoc and our topic for today is so interesting. It is a stroke. Marami pong na-stroke sa Pilipinas and I have to say, marami pong misconceptions or maling pag-aakala po kung ano po yung stroke at ano po ang ating dapat gawin tungkol dito. So please join us. You are welcome to put your questions. So sige po, pakilala muna sa mga bago. My name is Dr. Anna York Bondoc. I am a pulmonologist and internal medicine specialist. I also po have a specialty in critical care. And ako po ay from the University of the Philippines. My clinic is in St. Luke's Global. But ako po ay nakatira ngayon sa probinsya in San Juan, San Luis, Pampanga. Today, I am here in Wakwak para tingnan po yung bahay ko just before the lockdown. So please follow us po on YouTube. Naghahanap po talaga kami ng subscribers doon. And put your questions po below, COVID, non-COVID. Sana stroke po muna, but definitely we'll take COVID and non-COVID questions kasi alam ko talagang yan ang uso ngayon and we will do our best to answer them. So tara po at pag-usapan po natin what is a stroke at ano po ang dapat gawin tungkol dito. So let's start po with, siguro mag-true or false po muna tayo and let's answer a few questions regarding a stroke. Okay? And later on, may guide questions din po tayong nakalagay and you're welcome to put your own personal experience kung may na-stroke. Ilagay lang po dyan or what you are worried about. If you know anyone who is having a stroke, who had a stroke po, pakishare lang po para malaman din po nila. Okay, so let's go. Letter A. Ano nga po ba ang letter A? First, true or false?
A. Ang stroke ay pareho ng heart attack. Pareho silang problema sa puso.
Okay, is this true or is this false? This is number one misconception po talaga or maling pag-aakala tungkol sa stroke. If you Miss Kat, can you project the picture na pinili natin about the stroke or our poster na may nakahawak po ng kanyang ulo? Okay? Habang naghahanda po, I'm just going to talk. No? So the stroke is different, extremely different from a heart attack. Okay? In fact, some people actually call the stroke a brain attack. Okay? So the heart attack ay nasa puso at ang stroke ay nasa utak. Okay, that's the number one rule that you should think about. The heart attack is in the heart. Kaya nga heart attack eh. Okay, and the stroke. Siguro the proper name would have been brain attack, but the stroke po occurs in the brain. The damage po occurs sa utak po ng tao, hindi po sa puso. Okay, so heart attack, the damage is in the heart. Stroke or brain attack, the damage is in the brain. Okay? So, let's show the picture. Ayan po. Yan ba yung nandyan sa poster? Parang hindi. Anyway, pakibalikan lang po yung poster natin, Ms. Kat. And pick up the poster. It says stroke. Ano ito? Okay? So, let's go. Pero if you notice po, nakahawak sa ulo yung tao. Unlike nakahawak po sa puso yung tao. So, stroke, brain. Okay, brain. Okay, brain. Have you found the poster? Yung nakalagay po, stroke, ano ito? Ayan. Okay, wait lang ay, load lang po nila. Kasi biglaan lang po. Okay, letter B. Let's go to letter B.
Ang chest pain ay karaniwang nararamdaman ng mga na-stroke.
Ikaw, Reyna, true or false?
Yeah, this is something that they feel, parang common sa kanila. Most of the time, but not all the time.
So you say true?
Yes, but not all the time. But not all the time.
People who have a stroke are holding here, okay, not holding here.
Yeah, but sometimes...
Baka they're holding their heart kasi ninenervyos sila.
They feel like...
But no, okay, they're holding their head. They're holding their head. Okay, ayan. See the title, the stroke occurs in the brain. The heart attack and consequently the chest pain occur in the heart. Okay? So let's go muna to define stroke before we go into the symptoms of stroke. Ano nga ba ang stroke? Another word for stroke is CVA or cerebrovascular accident. Paki-project lang, I think I gave that to you, cerebrovascular accident. Huh? Ayan. So, cerebrovascular. Cerebro-brain vascular has to do with the blood vessels of the brain. So, the stroke has something to do with the blood vessels of our brain. Yan. Shortened version po niyan in medical terms, no, we sometimes shorten that to CVA. So, sometimes when we write, parang nagmamadali po yung mga doktor, sometimes they write the word CVA. Okay, otherwise known as cerebrovascular accident. So what's a stroke? Okay, so alam na natin ay sabi ko brain, ano? And then it has something to do with the brain and the blood vessels. So basically, ito po yung short description or short understanding ng stroke. Ang stroke po ay isang sitwasyon po na nakulangan po, bigla ang nakulangan ng dugo ang ating utak. Okay? It is a sudden event that occurs po when we have blood loss to the brain. Okay? How does that happen? There are two kinds of stroke po, no? Anyone wants to volunteer? What are the two kinds of strokes? The two kinds of strokes are infarct and bleed. Okay? Infarction. Infarct. Lalagay ko po, no? Infarct and then bleed. Okay? So, there are two kinds of strokes. Dalawa po yung klase ng stroke ng mga tao. First of all, stroke sa utak, two things. What is an infarct? An infarct po is a situation na may nag-block po, no? Ay, wrong spelling po. Bleed, dumugo, okay? So, yung infarct, punta muna tayo sa infarct, okay? Ang infarct po, nakulangan ng dugo. It is an infarction, okay? It's a medical term. Punta muna tayo kay infarct, okay? It's a medical term po na nakulangan po ng dugo. Okay, there are two kinds of infarcts ngayon. The thrombus and the embolus. Okay? Ano po yung infarct? It's a situation na wala pong dumaloy na dugo sa inyong utak. Okay? Wala pong dumaloy na dugo sa inyong utak. Ngayon po, pag wala pong dumaloy na dugo sa inyong utak, the blood vessels, they are the ones in the blood that feed oxygen to the brain. Ngayon ho, pag walang pumunta na oxygen sa utak nyo, you will lose brain cells immediately. Basically, they will die. Okay? Pag wala pong dugo, because the blood carries the oxygen, the brain cells will immediately start to die. So, it is a race against time. Kung pwede pong mabuksan o mabigyan po ng tamang daloy ng dugo ang ating utak. Okay, so it has to do with the blood supply. So, pag nawalan po, there is a blockade of blood flow. Okay, blocking of blood. Infarction. An infarction is when mamamatay po yung cells. In the heart, it is called a myocardial infarction. And in the brain, it's not really called an infarction, a brain infarction or cerebral, walang term na ganun eh. But basically, may nag-block po ng dugo sa inyong utak. Okay, what are the two things that block the blood in your brain? Number one is the thrombus. I think I projected po the words thrombus. Pakilagay lang po. What is a thrombus? A thrombus is a situation po na magbubuo po yung dugo nyo sa loob po ng blood vessel. Okay? And then it gets just so big or ano po, na nababara po yung ating blood vessel. Okay? So, it is called a thrombus. Okay? The term po is thrombosis. Okay? So, a thrombus po is an aggregation po of cholesterol, platelets, kung ano-ano po na nagbubuo po sa loob ng isang blood vessel. Pag lumaki ho yun talaga and then it blocks the blood vessel, then that is called a thrombotic event. There was a thrombus that blocked a blood vessel. Hindi tuloy dumalo yung dugo at hindi po na-nourish. Hindi dumating yung dugo sa likod ng bara. It's like, if you have you had a pipe, okay? So sobrang you keep throwing stuff like grease or whatever dun sa babaan po ng ano nyo, faucet nyo. Pag nakita nyo, hindi na hudadalo yung tubig, okay? So yun po, that is a thrombus. There is also what we call an embolus. Okay, what is an embolus? Yung embolus naman po is pag nag-travel si thrombus. Diyos ko. Wait lang ah. Si embolus naman po, so nagbuo na si thrombus sa loob po ng blood vessel, okay? Pag may parts po na konting nawala doon or na-dislodge or nabuong dugo, nabuong cholesterol or what we call sometimes plaque, P-L-A-Q-U-E, and it shoots out, okay? And then it gets stuck there in your brain kasi maliliit na po yung blood vessel na yon. That is called an embolism, okay? Or an embolus. So, ano yung nag-embolize? Usually, cholesterol, plaques, yung mga ganun po. No? All these things na nakakabara sa dugo. Okay, so that's the main stroke. It is an infarction na kulangan po ng dugo. It can either be inside the blood vessel, like a thrombus, or shoot out like an embolus. Okay? But basically, yung prinsipyo po nyon, may nababara. Okay? At yung nababara po ay nasa utak or mga ugat ng utak ang nababara producing an infarction. Okay. Pag nabara po yung isang portion po ng inyong utak, and that's why strokes are very scary, hindi na po natin nababalik yun. And that is what is concerning. Dead tissue does not come back. Okay? So you can lose brain matter and consequently, you can lose po some or a lot of function depending po kung gaano ka extensive po yung pagkabara. Okay? Kasi kung nabara ho sa malaking vessel, malaking problema yun kasi maraming sanga. Kung nabara po dun sa pinakamaliit na sanga, well, problema pa rin yun, but still the area is smaller. Okay? So that's the first kind of stroke. The second kind of stroke is a bleed. B-L-E-E-D. Yan po yung tinatawag po nating cerebral hemorrhage or pagdudugo. Okay? Bleed. B-L-E-E-D. Yes. That is called a hemorrhage. So, ang nangyayari po dito, okay, usually caused by high blood pressure po talaga to. So, sobra pong mataas ang presyon nyo, may pumuputok na ugat. I'm sure a lot of you have heard this. May pumutok na ugat sa ulo ng tatay nyo. May pumutok na ugat sa ulo ng lolo nyo. And dunugo po. That is what we call a bleed. Because the most common cause of bleeding is hypertension or high blood pressure. Yun po ang tinatawag nating hypertensive bleeding. Kaya po, yung mga 190, ganyan, 210, 240, tinatakbo po sa ospital kasi baka po duguin. Okay? And we need to bring down their blood pressure. There are many kinds of bleeds, pero wag na ho nating puntahan kasi masyado ng komplikado. It's a very wide, ang stroke is a very, very wide area of study. And there are specialists po sa infarct, may specialists po sa bleed. So, marami pong, I'm just giving you the basic para lang maintindihan nyo po yung sinasabi sa ER ng doktor. Kasi marami hong natataranta, tinatakbo ko yung kamag-anak nila sa emergency room and they cannot understand what the doctor is telling them. So hopefully, this can guide you a little. Okay, next. Letter B.
Letter B, ang chest pain.
Ayun yung sa chest pain. Okay, yes. Thank you. Sorry, Ms. Reyna, pinutol ko yung sinabi mo. But basically, what are the symptoms of a stroke? Yan po yung question ni letter B. I think there's a question sa questions so we'll go to that. But most of the symptoms, this is very important concept na kailangan po nating malaman. Okay? Yung sintomas po ng stroke, depende po sa area ng utak na tinamaan. Nagets niyo yon? Do you get that concept, Reyna? The symptoms of a stroke depend on which area of the brain was affected. For example, kasi baka may magtanong, bakit ma'am may nauutal, then merong nagko-collapse, then may nakahawak ng ulo, tapos meron naman hong naparalisado, but later on, when we all went to the ER, sabi po ng doktor, yun po yung stroke. Bakit iba-iba? Yes, this is very confusing to persons na hindi po doktor. And even I po, nakuha ko na lang ito habang as I was going further in my medical practice. Ang hirap pong intindihin ito eh. Okay, I'm just gonna try my best. Okay, so guys, if you cannot understand, just ask again. Our brain has different portions na iba't iba po, iba't ibang parte ng brain, iba't iba po yung kinokontrol niyang ginagawa. May portions of the brain that control thinking. May portions of the brain that control moving. May portions of the brain that control seeing. May portions of the brain that control movement. At may portions of the brain that control po speech and understanding. So kung saan nabara, okay, kung saan napunta yung bara, doon po kayo magkakaproblema. For example, nabara yung movement centers. Huwag na po nating tanungin which part of the brain kasi talagang magulo na yan. But sabihin na lang po natin, nabara po yung ugat that controls walking, then you can't walk. Nabara po yung ugat that controls speaking, then mauutal kayo. Nabara po yung ugat that controls, meron pong sometimes vision, ganun po, nagkakaroon ng ganun eh. So it depends po kung saan po talaga tinamaan or saan bumara ang ugat at ano po yung na-damage na portion ng inyong utak. Okay? And then, there are cases na multiple emboli or multiple strokes. So marami. Maguguluhan kayo kasi parang global yung problema niya. The larger the blood vessel that gets clogged, the larger po yung problema. Kasi the larger blood vessel feeds the smaller blood vessels. Okay? So that is the reason for the many symptoms of a stroke. But basically, ito na lang super high blood pressure. Naiba na po yung paningin, naiba na po yung sensorium. Ano yun? Iba na mag-isip, okay? Number 3, biglang naparalisado, biglang nautal, biglang nahulog, sudden loss of consciousness, hinawakan yung ulo and collapsed. Stroke po yun and go to the ER immediately. Okay?
Diabetes is the main cause of stroke.
Okay, Reina, true or false?
Bias ako eh. Yeah, yes and no.
Ano yun? True or false lang yung sagot?
Yeah, true and false sa akin ha. Hindi naman mainly diabetes eh.
Pero one of, okay, tama. Yes, very good answer. Yes,
So,
tama
true
yan.
and
I
false.
get your point. Diabetes is one of the main causes of stroke. Yun yung point niya. Okay? Which I agree with. But the main cause of stroke talaga, lalo na po sa Pilipinas, is hypertension. And the main cause po of the main dadalhin po na hypertension to you is a bleed. So it's called a hypertensive bleed. Okay? Main causes of stroke for both bleeding and infarction is kaya nga naku-confuse sa heart attack eh. Mataas ang cholesterol, diabetic, poor lifestyle, smoking, hypertension, all of the things that you would associate po with a heart attack, you can associate also with a stroke. So, very concerning din po. We always think na mataas ang being overweight, being obese, baka ka may stroke. Hindi ka lang baka ma-heart attack, baka ka may stroke. Okay? So, pag-isipan mo yun. Alright?
Ang na-stroke ay dapat pumunta sa emergency room para maoperahan.
Actually, medyo malabo itong choice na to and I'd like to explain this. The premise first is ang stroke ay dapat pumunta sa emergency room. Yes, dapat pong pumunta sa emergency room. Ino-opera ba ang mga stroke para maoperahan? There are some strokes that are operated on and I'm gonna go on to that later. But basically, the main reason that you should have a stroke, you should go to the emergency room if you have a stroke is may gagawin po if it is an infarction within a few hours or a thrombus or an embolus, pwede pong buksan yan. Okay, what does it mean? kung may bara, pwede pong buksan yung bara or tunawin yung bara. Two ang pwedeng gawin. Buksan, which is to flatten the thrombus against the wall. Yun ang ginagawa po ng mga vascular. Or tunawin, which is to give, there is a stroke buster, yung tinatawag po nila, which is tissue plus, TPA ang tawag doon. I don't wanna go, it's too complicated. Pero meron pong ibibigay para ma-dissolve po yung clot. So basically, an infarct is caused by a clot, no? Either a thrombus or an embolus. So clotting talaga. So that's why you should go to the ER. Kung bleed naman po, you should also go kasi big bleeds po are very concerning kasi po, ito yung inooperahan. Pag namaga po yung utak nyo, they need to, may gagawin po yung, yung sirohano to ease the pressure on the brain po, no? So some bleeds are operated on, not all. Okay? So yun po yun. You need to go to the ER basically. Once you recognize that you have had a stroke or that your relative, your dad, your lolo, your brother, ikaw, go na to the ER kasi meron pong pwedeng gawin. Okay?
Walang gamot sa stroke.
This is true and false din yan actually. So I will go, may gamot po, like if you get to the ER very quickly, no? If you get to the ER very quickly, pwede pong tunawin yung infarction, the clot, the thrombus, or the embolus. Pwede pong tunawin. They can also do procedures po na flatten them on the wall. Meron din pong ganon. Okay? So, essentially, may gamot sa stroke. If you've had a bleed naman po, they cannot really, meron hong procedures for bleeds. I forgot to mention this. I think the question, they can clip aneurysms. So I'll go into that later. Parang may tanong ako about aneurysm. And there are also some procedures po that can be done to lessen the effects of a bleed. Kung nangyari na po si bleed, you can have a re-bleed. So kung mataas po yung pressure nyo, they need to bring it down para konti lang yung lumabas doon. Kasi blood pressure puts stress on the wall, meron na ba kayo narinig na namamaga ang utak? Yes. That's why we can also give medications like steroids kasi po parang nasugatan po yung utak nyo, mamamaga yan eh. Pag namaga po yung utak, mahirapan po kayo because your brain is inside your head. Pag namaga siya, wala siyang space para mamaga, basically, at magkakaroon ka ng problema. So, there are things that can be done for a stroke acutely. Pero tama rin ho yung sinasabi nila, once you have lost brain tissue, talagang deads na yan. Okay, deads na yan. Wala na bang hope? Well, there is therapy talaga. So, as soon as you can recover, therapy can help you get back a lot of what you lost po. Magaling ang therapy, it can help. Plus, lalo na po kung bata pa, your brain can make other connections eh. Yung ugat niyo po magko-connect. The brain has the magnificent ability to heal itself. Kaya lang, kung talagang masyadong massive po talaga, it can lead to permanent loss of function, permanent disability, and can even lead to death. So, yun po yung nakakatakot sa stroke is yung permanent disability po na mangyayari. Okay? So, I think those are, let's look at the pictures para makuha po natin. And I think there are a few guide questions. Everyone is welcome po to put questions below. So, yan po, nag-collapse, I think that was the first photo. Nag-collapse po yung tao holding his head, no? That often happens po in a bleed. If somebody just collapses in front of you, malamang though it can be an infarct, but really, most often po, it's a bleed. A very severe headache po should also be seen in the emergency room. Very severe headache po, dapat mapunta rin po sa doktor. Lalo na if this is the first headache in your entire life. Tapos pag yung BP mo, 160, 180, 190, naku, ER ang tawag dyan. Okay? Ayan. CVA, short for cerebrovascular accident. This is the medical term po for a stroke. The stroke po, yun po yung layman's terms, pero pareho lang po yan. Okay? Ayan. Actually, that's more of a thrombus eh. Well, it's like a thrombus that became an embolus. Nakita mo nagbuo-buo siya. Those are platelet clumps eh, at the inside the blood vessel. So, nakikita mo na babara siya talaga. Hindi wala talagang dadaan na dugo dyan. Nagdidikit-dikit yan. And then at the end, you can see parang parts of it are shooting out. That is when the thrombus can shoot out embola. Yung embola ay maliliit na portions. Babara din po yan. Ayan, CT scan. I forgot to say this. How do you diagnose a stroke? Physical exam, history, physical exam, and number 1, CT scan po. CT scan. Yung iba nagpapa-MRI, pero talaga in the acute setting, CT scan. The best way talaga sa stroke is to prevention. So talagang kailangan po magbago ng lifestyle. Lalo na po those who are overweight, diabetic, naku, number 1, hypertensive, i-control po yung BP nyo o may stroke talaga kayo. Okay, I think that's it. So, a stroke is one of the most common medical emergencies po that is occurring worldwide, lalo na po dito in the Philippines. Hypertension is the number 1 risk factor po talaga for stroke, and it's very important to control your BP. Once you recognize that someone is having a stroke or that you are having a stroke, you need to go to the emergency room immediately. At gagamutin po kayo doon to lessen po the effects and hopefully mabalik po yung inyong function 100%. Kung kayo po ay makasurvive ng stroke, and people die from strokes, I would like to say, our hope talaga ay hindi po kayo ma-disable para at kailangan po magbago po ng lifestyle. Okay?
Okay.
Reyna, nag-gets nyo ba yon?
Yes, malinaw po, Doc.
Pero daming confused eh, including professionals. I'd like to state even myself as a medical student, it took me a long time to understand strokes. That's why I didn't even go into neuro because I couldn't even understand what was going on. Masyado akong intimidated and it's difficult. Pero for the lay person, what you need to do is recognize, prevent, recognize, and go to the ER.
Yes, Doc. Actually, ako din confused dito. As I told you, diba, honestly, all I thought is...
Marami, it's very common.
So, pero magka-connect pala ang heart and the brain when it comes to stroke, no? They are connected somehow. Yon. Okay, questions na po tayo. Kailangan ba pumunta sa ER kaagad? Bakit?
Yes, you need to go, especially po if you're recognizing that the stroke is happening. The stroke usually happens over, parang sometimes it's evolving eh. It's getting worse, like lumalaki yung bleed, you need to go to the ER talaga. Yung iba naman, biglaan, ayan, paralisado na. Go to the ER. Pwede pong tunawin yan.
Actually, Doc, this is what I realized, no? Yung mga pagsakit-sakit ng ulo na hindi siya biglaan can lead to that pala. That's what happened to yung sinishare ko po sa inyo sa pamangkin ko. Ang tagal na masakit ng ulo niya, hindi nawawala. Yung pala,
But
there
should
are...
be worked up.
Yes.
Headache should be worked up.
So,
Lalo
yun.
na po kung you never had a headache before and then biglaan lang po. They should be worked
up.
up.
And then hindi nawawalang headache kahit matulog ka, gumising ka.
Tapos dapat i-work up.
Yeah.
The worst headache in your life. If you feel like you're having the worst headache in your life, subarachnoid hemorrhage po yan. That is a bleed. Go to the ER.
Yes. So, yun. Just to share with everyone. Okay, next question. From Mr. Glenson Loyola, ask ko lang po kung pwede magsabay ng attack ang stroke and heart attack.
It can happen, pero sobrang malas mo naman ata, Glenson. I mean, it can happen, it can happen. Why not? Pero parang wala pa talaga akong narinig. Hindi, I've had people na stroke and na-stress yung puso, na heart attack. Merong ganon, you can have a heart attack while having a stroke. Like, for example, you had a stroke yesterday, dinala ka sa ER, then you got put in the ICU. Since mahina na rin yung puso mo, na-atake ka, possible. Pero in general talaga, they tend to be separate. Unless sobrang malas mo talagang tao. But basically, a heart attack is a different issue and a stroke is a different issue. Ito, question. Can a stroke come from the heart? Yes. How is this happening? Okay. For example, one of the things that I didn't mention is atrial fibrillation. Atrial fibrillation is one of the most common causes. Wait lang, itatype ko lang dito. Atrial, it's a rhythm disorder po, no? Wait lang ah. Yan. Yan ang tinatawag po sa mga doktor, AFib. What is AFib? Okay? AFib is irregular beating po ng inyong puso. You can feel it in your wrist. Basta iba. Basically, pag nag-iiba po yung beating, the coordination of the beating of your ventricles, and the atria, hindi po siya coordinate. Pag ganun ho yung hindi siya, kasi normally the heart beats, ganun bag. Ganito po yung atrial fib, gumaganon yung puso nyo. You can feel it, nagkakalat po yung kalat yung beating sa Once the beating of your heart is not parang, ano ba tawag dito? Aligned, coordinated, uncoordinated beating of the heart, umiikot yung dugo ngayon. Hindi maganda yung paglabas. Okay? Sa pag-ikot niya, it tends to stick to each other. By tending to stick to each other, it becomes a clot. Okay? And then it shoots out, and then it comes out of your heart biglaan. It will go up, and then lodge in your brain. So that is an embolus due to abnormal heart rhythm. Meron pong nangyayaring ganon. So if somebody has atrial fibrillation, that person, either we put the rhythm back to normal, or binibigyan po natin ng para mawala yung pagkalapot ng dugo niya, because that person with abnormal heart rhythm is in danger of an embolic stroke. Nag-gets niyo ba? That's so hard. But basically, kung hindi po maayos yung pagbeating ng inyong puso, magdidikit-dikit po yung inyong dugo. At a certain point, it will shoot out from the heart and clog your brain. So, two things. Kailangan ayusin yung beating ng inyong puso. Yung pagtibok, tama. Maayos dapat ang pagtibok ng inyong puso. And number two, dapat po nipisan ng inyong dugo para ho hindi magbuo-buo. I hope you got that. Okay, next.
What are the risk factors for stroke?
Ayon, sinabi ko na nga po. That's why actually it's confusing kasi it has the same risk factors as heart attack. Number 1, hypertensive. Number 2, bad lifestyle. Number 3, smoking. Number 4, diabetes, high cholesterol. And becoming older, and then another one is abnormal heart rhythm. So lahat po yon can cause a stroke. I'm just talking about the most common, ha? There are uncommon reasons for stroke like lupus, taking drugs, ganun po, no? Infections. Pero wag na ho natin pasukan yon. That's for another day. Kasi ho, the most common really is issues having to do with hypertension, diabetes, cholesterol, and the same stuff that forms plaques in your heart can form plaques in your brain and in your carotid arteries.
Magkaiba po ba ang causes ng heart attack and stroke?
Magkaiba, totally. The heart is in the heart and the stroke is in the brain. Parang nagugulo ng mga tao, no? Heart attack po, yung magkaroon po ng bara sa loob po ng ugat ng puso nyo. And then a certain portion of your heart will die. Ang stroke, dalawa. Either babara or dudugo. And it all occurs in the brain. Yun. May pagka-related rin naman siya. I mean, yeah, it's possible. Like if you're having a heart attack, then you don't perfuse your brain well, kasi tumigil ng konti yung puso mo, then you lost brain function, theoretically, nawalan ka din ng blood flow. But the concentration is in your heart. Okay? Yung stroke talaga, the concentration is in your brain.
Okay, from one of our viewer, Doktora, what is an aneurysm? Yung nangyari sa flight attendant, sa brain ba yon?
Yung nangyari sa flight attendant, if I'm not mistaken, was abdominal. Kaya nga medyo weird eh. But yes, there are brain aneurysms and this usually happens to people na usually younger, but it can happen also in older. So what's an aneurysm? An aneurysm is a weakness in the wall of the blood vessels. Like meron nga pong, sometimes it's inborn eh, or meron din pong hypertensive, numinipis, pag because of the stress on the wall of the blood vessels. Pero ang aneurysm basically, bigla siyang puputok. May mahinang portion ng inyong blood vessels. Lalo na pag mataas po ang presyon, or it just happens na kung minsan wala man nangyayari, pumuputok po siya, and somebody can drop dead. Yun po yung aneurysm. And may rin po yan. It can happen, but it is rare. And really, wala pong screening talaga eh. So kung repeatedly sumasakit ang ulo nyo, patingin na rin ho kayo.
From Miss Cathy Rodriguez, Doc, good morning. Do most strokes occur at night with a normal blood pressure? What are the warning signs days before stroke?
Ano po yung tanong? Pakiulit lang po.
From Miss Cathy Rodriguez, Doc, good morning. Do most strokes occur at night with a normal blood pressure? What are the warning signs or days before stroke?
Pwede pong most strokes and most heart attacks, ito lang most cardiac events occur in the morning. And a lot of stressful events occur early in the morning kasi yun po yung bugso ng circadian rhythm eh. In fact, studies have shown na early morning is the most dangerous time. Can they occur with normal blood pressure? Yes, ma'am. For example, sinabi ko nga po, may AFib kayo, no? Abnormal yung rhythm ng yung puso nyo. Can shoot up an emboli, normal ang BP. You can also form a thrombus po with normal BP. So yes, it can happen with normal BP. Most bleeds occur with high BP, okay? Kasi nga dalawa si infarct doesn't need high BP. Si bleed usually high BP. Okay? Usually high blood pressure. What are the warning signs? Meron pong tinatawag na transient ischemic attack. Ito po yung parang dumating then nawala in less than 24 hours. That is a warning sign of a stroke po. Bigla kayong humina and then, or nautalan din nawala. That is a warning sign of a stroke and you need to immediately go to the doctor para ma-assess po yung inyong stroke risk or the risk of it happening again. Tapos pag in MRI or CT malinis, pero may nangyari, that's what we call a transient ischemic attack. And you need to go po to the doctor to have yourself assessed kung ano po yung inyong stroke risk at kung ano po ang pwede pong mabago tungkol po rito.
From Ms. Che Ecaldre, Comandante, Doc, good morning. Meron po bang aneurysm na sa stomach ang hit or I mean affected?
Yes, marami po. Lots of people, this is called an abdominal aneurysm. Pero lumalayo na po tayo sa stroke, okay? Again, this is vascular, okay? These are vascular issues. What is the meaning of vascular? Blood vessels, okay? And blood vessels occur in all parts of our body. Hanggang sa dulo ng daliri, meron kang blood vessel. So, yes, an aneurysm is a weakness in the wall of a blood vessel. It can occur po in the brain. It can occur po in the, yung tinatawag pong arch of the aorta, yun po yung thoracic aneurysm. And abdominal aneurysms usually occur po in the abdominal aorta. That all can happen. But let's confine ourselves to stroke. Stroke happens and stroke or aneurysm nangyayari po sa blood vessels po ng ating utak.
From Miss Elizabeth Simbulan, mother ko po 3 times na na-stroke po. Pero recovered po siya from that last admission niya po. Lumabas after medication niya, stroke came from hyperthyroidism. Pwede po pala yun? Tapos ngayon po, suffering siya ng Bell's palsy. Walang maayos na words from her mouth po. Koreano words na lumalabas ng mga salita niya.
I am not familiar with hyperthyroid as a cause of stroke, okay? But I am not an endocrinologist, so tingnan natin. Can hyperthyroidism cause a stroke? Okay. Tama nga naman, hyperthyroidism is associated with atrial fibrillation and cardioembolic strokes. So, ito po yung sinasabi kong hindi po maayos yung pagbeat ng puso. Magulo. It's not coordinated. So, yun po yung association of hyperthyroidism and stroke. But ako, I am not an endocrinologist. So, um, i, I would leave that to the endocrinologist. Okay? But what got me dun sa tanong niya is 3 times na po. One stroke is more than enough for one person talaga. And we really need, once you have a stroke, or even before you have a stroke, ina-assess talaga yung stroke risk natin eh. And if you had a stroke, sana, the doctor will really work you through what you need to do. Kasi, thank God na nakasurvive ka, but, it can happen again. With regards to cannot talk, dysphasia, aphasia, difficulty speaking, naapektuhan po doon or tinamaan po doon is the area of the brain that controls the way we speak. So I'm sorry po na that happened. And siguro po, pa-check up kayo, ma'am, just to make sure. And, warning sign pa lang ho na stroke, anuhin nyo na. Kahit wala pang warning sign kung overweight kayo, gumawa na ho kayo ng paraan or mataas ang BP nyo, take your medication. Kasi sa Pilipinas po, the most common is really high blood pressure. Sige po, I receive a text na napakarami pong tanong. So let's make it fast. Okay, pasyensya na ho. And alam mo, ito talagang, this is really so extensive. Let me find a neurologist and pagtiriyahin pa natin to kasi I am not really an expert in stroke. Though because I am a critical care specialist, I have taken care of a lot of acute strokes.
Okay, Doktora, medyo ikat na natin ng mga up to 3 questions na lang po. And then the other ones, we can move it to a new discussion po. Ano po, Doc?
Sige lang, go. We just keep it going as it goes, okay?
Okay, from Mr. Raymond Alancese. Doktora, paano po na-identify na ang stroke ay mild stroke lang at ano po ang difference?
Yes, walang medical kung ano mild at saka major eh. So I guess a mild stroke would be minimal minimal residual. The term is residual, The term is residual, RESIDUAL. Ano po 'yon? What does it mean? It means kung ano po yung maging kapansanan niyo po after the stroke. And it is very important for us na sana the person could work. Hopefully, the person could be restored back to the normal. Though talagang once you lose brain tissue po, you lose brain tissue. So, mild po, siguro, my interpretation of mild is konti lang po yung nangyari. But, a mild stroke, kung hindi nyo po aalagaan yung causes, could become a major stroke. Yun lang po.
From Mr. Guy Lumba, Doktora, ask ko lang po sana kung saan may libreng swab test for senior citizen. Thank you so much po.
I don't know. Why do you need to be swabbed? If you are exposed, lock yourself in your bedroom, okay? For 14 days. Ngayon, pag hiningal ka, that's the time you should get swabbed. Not everyone should be swabbed. Please lang ha, malinaw lang ho yan. Not everyone should be swabbed, lalo na kung walang pera. Or hirap, I don't want to say walang pera, lalo na kung hirap po ang finances po ng tao. At sino ba naman ang hindi po hirap ang finances, lalo ng pangatlong lockdown na po to. Okay? So if you have been exposed to COVID, lock yourself in your room for 14 days. Pag hiningal po kayo or something is happening, then that's the time that you could be swabbed. Okay? Hindi po automatic swabbing na ngayon. Okay, next. Let's confine ourselves please to the stroke questions kasi po sabi nyo marami. And sana po let's give chances rin sa iba.
Okay, so Doktora, From Mr. Glenson Loyola, pwede pa din bang ma-stroke kahit healthy naman ang lifestyle?
Pwede. It's called genetic. Pwede hong ma-heart attack ang pinaka-fit na nagmamarathon. Opo.
Next question.
But again, it's better to prevent. Okay, next. Kasi talagang people tell me, Diyos ko, ba't nangyari to sa akin? Ito lang meron na kaming, this is heart attack naman. I had this patient who was 35 and had a heart attack. So he was a marathon runner and very thin. So he was really like, Indian pa. So he was asking us, doctor, what happened? Yun pala, upon investigation, yung tatay niya na-stroke ng 30 at yung kapatid niya, na heart attack ng 30 at yung tatay, at yung kapatid na heart attack ng 28, basically nasa lahi. Meron pong ganon. So if your parents have had a stroke, please investigate kung bakit. High blood ba sila? Then control your high blood. Diabetic po ba sila? Control rin po yung diabetes nyo. Mataas po ba yung cholesterol nila? So, genetics. It's sad, but ganun po talaga. But the most important is to be aware and to do something about that. Yun po yun. Okay, next.
From Miss Meldy Mendoza, panic. Tatay ko po chest pain, mild stroke po.
Okay, I hope he's okay. Okay, next. Thank you for sharing that.
From Miss Mia
And again, sandali lang. Is your dad high blood? Is your dad, basically, examine your genetics. Okay? Next. Next question po.
From Miss Mia Mar Mercado, infarction po ang pagsabog.
Baka you mean infarction? No,
From Miss Mia Mar Mercado, Apo, infarction po ba ang pagsabog?
Wala pong sumasabog. Well, some people would say an embolus is sumasabog po ng blood clots, okay? Totoo naman. Kasi in English, the term is a shower of blood clots or a shower of emboli. So we could say sumabog po yung mga blood clots, possible. But an infarction po essentially means lack of blood supply.
From Miss Marie Del Sideria, Doc, yung left arm ko po bigla na lang nanginginig. Mag-isa, dati mild lang, pero past few days, medyo tumatagal na like 1 minute.
Ano po, nanginginig?
Ulitin ko po, Doc, yung left arm ko po bigla na lang nanginginig mag-isa, dati mild lang. Pero past few days, medyo tumatagal na like 1 minute.
Kayo, ma'am. I cannot diagnose anyone based on a history po na ganyan. My best advice is to have a checkup po. And better do it before the lockdown kung nasa Metro Manila po kayo. Again, may telemedicine naman po.
Bati muna po tayo, Doc. From Miss Jairis Oporto. Hi po, Doktora. Watching from Santa Rosa, Laguna with love.
Wow! Thank you.
From her din po. Worth watching. Thank you po, Doktora. We love you. God bless po.
Wow. Thank you.
Ito naman po from Mr. Dongski Dagpin. Hi po, Doktora. Watching from Mindanao.
Wow, saan po ka? Ang ganda pa ni Dongski. Thank you so much. Saan ka sa Mindanao? Thank you for joining us.
May tanong po si Mr. Dongski Dagpin.
Sige po, go.
Yung biglang pagkahilo po, sign po ba yun ng low blood?
No, it's actually a sign of high blood. It's a very common sign of high blood. Opo. It's a very common sign po of hypertension. But again, don't panic ha. Pa-BP lang naman po. And there's also po a lot of reasons kung bakit po nahihilo yung tao, including vertigo, blood sugar, ang marami po, ninenervyos. So, if someone suddenly got hilo in front of me, first thing I would do to check po is find out if that person is diabetic, investigate, baka naman nag-insulina, walang kinain. And second, is take blood pressure. Very common po. So yan lang po. Again, thank you so much for joining us. Follow us on YouTube. And last words on stroke, it is preventable po. So please know your risk. Alamin po kung may risk factors talaga kayo. High blood ba kayo? Mataas ba cholesterol? Na-stroke ba yung tatay o nanay nyo? Diabetic po ba kayo? Pag nalaman nyo po lahat yon, try to work on what you can do. Tanungin nyo po yung doctor nyo how you can reduce your stroke risk. Kasama na rin po yun your heart attack risk. So again, the most important, blood pressure po. Yun lang talaga. Blood pressure, blood pressure, blood pressure. Maraming salamat po and good morning. Thank you.